Welcome to VidZet's podcast. I'm Dr. Ted Noel. Today we're going to talk about one thing that's the question that nobody really asks, and that is health insurance actually a good thing? Now, by health insurance, we're talking about insurance that looks something like what most people think about today, and that is an insurance that has a fairly small deductible, covers a lot of things up front, and has a very limited out-of-pocket maximum. That's, in theory, what we're looking at. But if you listen to the Democrats, a lot of them are saying, no, you can't possibly get rid of Obamacare. Millions of people are going to get sick and die. And they just keep repeating this and repeating this. And the Republicans don't defend their action at all. They just kind of move along, do things, and don't add any argument against the Democrats. So the question really arises, is there data to support the Democrats, or is there data to refute the Democrats? And if we go back and look, the first big study that actually looked at health insurance like this was back with the Rand Corporation in 1971 through 1982. And the basic points that they found were that health insurance didn't do much. Let's look at it in specific. They recruited 7,700 people. There were 2,500 families, more or less. They tried to make sure that they had a balance of urban and rural. And then they had a whole bunch of different plans where you had a free plan, 25, 50, 95% co-pays, an HMO plan. And they adjusted it so if you were really poor, your co-pays were smaller. And they ran this for 3 to 5 years. And it was really a pretty well-designed study when you look at it. There's one key finding, and this is something we've talked about before on VidZet, and that is that when you have skin in the game, you are more careful with your money. You're going to be careful that when you buy something, you need it, not, oh, it's just there. And this was a key finding of the Rand Corporation study, that when people had skin in the game, they had to have a copay. And it didn't matter a whole lot whether it was 25%, 50%, or something else. As long as they were paying out of pocket, they didn't overuse medical resources. And the interesting part was people were not shopping for the cheapest doctor or the cheapest emergency room or anything like that. They just weren't using it. And you say, okay, well, are they keeping themselves from health care that they really need? The answer is, drumroll please, whether you used the care or didn't, there was no change in health. In particular, there was no decrement in health. That is, nobody got sicker. Now, we did see something that was interesting. If you had insurance, particularly when you had the free insurance, risky behaviors increased. That is, people would smoke more and they got heavier. And so these are things that say, wait a minute, insurance may actually be hurting people. Now, let me talk one thing about statistics here. There's something called statistical power. And basically it describes a situation where you say, do I have enough people in my sample to be able to form a solid conclusion? And if you're looking at a conclusion that's fairly clear, it doesn't take a lot of people. If you're looking at one that's down in the weeds, it takes a lot of people. Well, when you look at 7,700 lives, you probably have enough people to have good statistical power. Now, interestingly enough, in 2006, two economists, Dave and Kestner, did a slightly different study, and what they did was look at people who were turning 65 and going on to Medicare, where they're mandated to have health insurance. And the only significant thing they found there was when everybody moved on to health insurance, there was an increase in risky behavior, that is, smoking and obesity. Interesting. It seems like health insurance hurts people. It doesn't help them. And remember, one of the points we've been making all along at VidZet is health insurance is a subsidy to the health care industry. It provides money, guaranteed money, to hospitals, to doctors, and to insurance companies. It's not about providing care for the patients. It's about providing care for the wallets of the people who care for patients. And many of them are quite wealthy. So health insurance was designed to make sure that those people were taken care of, not the patients. Now, let's go back again. The Obamacare argument was we need insurance because having insurance is the same as having access to health care. That's simply not true.
Hi, I'm TV talk show host, political analyst, and national spokesman Josh Bernstein. I want to tell you guys about an amazing group known as the Association of Mature American Citizens, or AMAC for short. AMAC is the conservative alternative to AARP. We are a seniors-based organization for seniors 50 years of age and older. We have all the same types of products and services an AARP would have. The only difference is when we lobby on behalf of our members and Congress, it is to give more power, more control, and more freedom to seniors and their health care decisions. So please check us out at www.amac.us. Again, that is amac.us, or call toll-free 888-262-2006. Again, 888-262-2006. Tell them that you heard Josh Bernstein, their national spokesman, talking about them anytime you see this video, and we will give you a free membership. That's right, folks, a free membership just for mentioning this video. Call us at 888-262-2006 or find us on the web at amac.us.
And in Oregon, 2008, Oregon was able to come up with enough money to add 10,000 people to their Medicaid rolls. That's all they could do. They had a whole lot more people were eligible, but they ran a lottery among them to pick off the people who would join. And they ended up with about, now how many people I say I didn't, but there are 25,000 people they added in Portland. The whole study, I should say, involves 25,000 people in Portland who either found their way onto Medicaid or missed out on the lottery. So you have people who are identical in socioeconomic status and people who are identical in geographic status and presumably identical in health status, because when you have 25,000 people in your study group, you're going to level out all of the differences. So you have high statistical power. This study has been reported on a number of different places, and it was done by economists, not by doctors. And what they found was, for each dollar that was spent, 20 to 40 cents of value went to the patient. At the best, 40 cents out of a dollar was benefit to the patient. We would have been better off taking 40 cents out of every dollar spent, just give it to the patients, than the other 60 cents that went to, drum roll please, the healthcare industry. It was a subsidy for insurance companies, for hospitals, and for doctors. Remember the law of subsidy. When you subsidize something, you get more of it, and it gets more expensive. This was a transfer payment, strictly a reverse Robin Hood. We will tax everybody, and we'll give this money to the rich. And what did the Oregon Medicaid experiment find? No significant improvement in measured physical health outcomes. When you read the paper, you read the economists, you walk through all of the fancy mathematics, with a study that should show a very high power of statistics, what you end up with is a study that says we can't identify anything. There was no difference in health outcomes. And when you have this many people, either the difference between insurance and no insurance is very tiny, or it's not real. That's just what happens. There were 4 measures they looked at: blood pressure, cholesterol, hemoglobin A1C, that's the effect of high blood sugars on hemoglobin, and cardiovascular risk using a Framingham score. And, ultimately, when you get all done with it, the people who actually won the chance to enroll, only about 30% of them actually did enroll. Once again, there were no significant improvements in 2 years. Medicaid patients spent each year $1,172 more on health care than those without Medicaid. That is, Medicaid was tapped for that much money. Granted, having insurance reduced their financial strain, but when you look at it, there were only 5% of patients who would have had any serious financial strain. And those are the patients who could easily be enrolled in a high-risk pool, which is something else we've talked about at some length. As one commentator put it, if Medicaid were a new medicine applying for FDA approval, it would be summarily rejected. It doesn't work. Now let's deal with one other little thing along the way, the idea that if you don't have insurance, you don't get care. It is a flat-out lie. There's a law called EMTALA, E-M-T-A-L-A. You're welcome to look it up. And basically it says, if you hit the ER, they have to take care of you. End of story. The other thing that does tend to happen is if you have no insurance at all and you hit the ER, you get enrolled in Medicaid rather quickly. So it ends up being no big deal. Now, one of the big things here is, once again, the Oregon Medicaid experiment showed that people on Medicaid versus those not on Medicaid, otherwise all the same, use emergency rooms 40% more than people who aren't on Medicaid. And this is something all of us who've gone through medical school know, because you look in the emergency room, particularly early in the morning, who do you have? You have the Medicaid mamas who's got a little kid with a snotty nose and is fussy and isn't letting mama sleep, so she's coming to the ER. It's not because the little baby has anything notable. It's because mama wants to sleep and the ER is going to take care of it. I will let them take care of everything. What are the big takeaways here? 1, health insurance is no good for nobody, not in its current design. The 5% of people who saw a significant benefit were the ones with a catastrophic risk. And that's where insurance really is designed to work, where you have insurance against a big time risk. In Lloyd's of London parlance, that's called reinsurance. You self-insure for a certain amount, you expose a risk, and then at the end, somebody picks it up when you have a really big loss. But most of the stuff is going to be out of your pocket. And people go, oh no, how can we possibly do that out of my pocket? Yes, out of your pocket says you don't use medical care when you don't need it. That 40% increase in emergency room visits had no benefit. Count it, 0 benefit to health. This was an outcome study. And you can't go any other direction with the data. Insurance ends up being a subsidy for doctors, hospitals, and insurance companies. It's transferring money from the taxpayer to those people who are better off than most people in the country. And we don't want to be the sheriff of Nottingham, robbing from the poor to pay the rich. What we really want to do is look at health care. Now that is a different kind of a question, and we'll talk on another time about preventive care and wellness programs and so on, how well they work or don't work. But the issue here is insurance doesn't do anything. So if we were to simply eliminate Medicaid, it wouldn't hurt anything. We replace it with high-risk pools. But better than all of that is a health savings account, because a health savings account will do two things for the Medicaid population. One is it gives them coverage, but the incentive not to spend money because you're going to have money at the end of the year reduces use, in the insurance term, risk experience. And those people won't be doing it as much, and they begin to learn how to save money. Very important when you're in that stratum. So all things considered, let's put it in simple terms. Insurance in our current model is worthless. It is a huge expense. It is a subsidy which causes us to get more health care at higher cost than we would have without insurance. It is a guarantee for health providers, not for patients. We need to cast the story in that language so people begin to understand that what's really going on is something radically different from what's being advertised. I'm Dr. Ted Noel. Thanks for watching.